Hello and welcome. This is Dr. Mo, a cardiologist and an electrophysiologist with James River Cardiology. If you have AFib and you have a high risk of bleeding, then Watchman could be a life-changing option for you that will decrease your risk of bleeding. In people with AFib, the chance of them having stroke is 5 times higher compared to normal population. And that's why they are usually on blood thinner, including Eliquis, Xarelto, Protexta, or warfarin. Those medication comes with a price, and the price is they do increase the risk of bleeding. In a certain patient population where they do need to be on blood thinner to prevent stroke, but they also have a higher risk of bleeding, then Watchman could be very handy. So what is a Watchman device? A Watchman is a plug that we use to plug the pouch that we have on the left side of the heart where clots usually form. It is sized as a quarter, and it's a one-day procedure that we do in the hospital. So now we're going to talk about the procedure and the steps. Number 1, the procedure is done under general anesthesia, which means that you will not feel anything throughout the procedure. After being sedated, we're going to do something called a TEE, which is a camera that goes through the throat down to the food pipe to look at the heart from the back. And the reason why we do that is to make sure that you don't have a clot in that appendage before we go in to place the Watchman. After that, we're going to access the groin twice. You'll have 2 catheters that goes all the way up to the heart. One of them is a camera that you will have inside the heart, and the other one is the sheath that has the device. We're going to cross from the right side to the left side. We're going to find the appendage. We're going to inject some contrast to size the appendage a 3rd time. After that, we're going to use the right sized device for the right appendage, and then we're going to deploy that device in the appendage. After deploying the device, we're going to make sure that the device is stable and there is no leaks around it. And if it fits the criteria, then we will deploy the device and remove all the catheters outside of the heart. So talking about the safety and the risks of Watchman, Watchman is a very safe device to deploy. There is more than 300,000 devices deployed worldwide with a success rate of 98%. The risk of anything bad happening is less than 1%. Risks include bleeding. The risk of bleeding is 1 in 1,000. If we do this 1,000 times, one might bleed. If you do bleed, we're going to hold some pressure and the bleeding usually stops. If it doesn't stop, we need to do ultrasounds, x-rays to find out what's going on. When we put catheters inside your body, the body can look at those catheters as foreign material, and it can form clots around those catheters. If that clots goes to the heart, it can cause you to have a heart attack. If it goes to the brain, it can cause you to have a stroke. Knowing that, you're going to be on blood thinner throughout the procedure to make sure that this is not going to happen. And lastly, if we have catheters inside the heart, there is a chance that those catheters can damage the heart muscle. And if that happens, you might bleed in the area around the heart. And if that happens, we need to put a drain to drain it. And if that is not enough, very rarely we need to open the chest to fix it. And again, the risk of anything bad happening is only 1%. There is a 99% chance that nothing bad is going to happen and you're going to be sent home the same day. The procedure itself takes around an hour, and then you will be sent to recovery to wait for 2 more hours. And if you don't bleed, you go home the same day. If you do bleed, you're going to stay with us overnight. If you have AFib with high risk of bleeding, Watchman could be a life-changing device for you. Thank you for watching the video, and we're excited to see you in clinic to talk more about your options.